Are you struggling with a lumbar stenosis? If you are, you're not alone. In this video, I want to walk you through some important concepts and effective strategies that you can do today that may help relieve pressure, improve mobility, and also hopefully help you regain some of that quality of life. So if you are struggling with the symptoms of a lower back stenosis, or you're just hoping to stenosis-proof your back, then let's get started. G'day and welcome back to the channel. My name's Grant Frost, and I'm a senior physiotherapist who has treated thousands of backs. And for those unaware of what a stenosis is, we give a label of a stenosis when we see that the foramen of the spine, which are the gaps created by the spinal column and the joints of your back, that are the gaps that the nerves exit from as they leave the spine to travel down through your body. And through a number of different reasons, if that space becomes reduced, it can naturally start to short circuit the function of your back, make it more extension sensitive where it doesn't like to bend backwards. But depending on how progressed it is, you can start to create some irritation and annoyance of the nerve roots as they exit that spine. That might be sciatica for some people. If you have a stenosis in your neck, which is outside the scope of this video, you may start to experience some aches and pains, pins and needles and numbness through certain aspects of your arms. But the point of this video is that I want to talk to you about some of the reasons behind why you may develop a stenosis in your lower back and hopefully show you how to treat that now, but also give you an exercise or two that you can do to help improve your stenotic symptoms if they're there. And if you are a member of the channel, there'll be an extended cut of this video. So please consider becoming a member if you watch this video and you're left wanting a little bit more. But with that being said, the first thing I want to talk about here is the impact of your pelvic positioning on the health and function of your back and its role in potentially contributing to a stenosis over time. So the reason why your pelvic position is potentially really important in the onset and persistence of stenotic symptoms is the impact that it has on the function of your lower back. And the pelvic position we're talking about is an anterior pelvic tilt, where your pelvis tilts forwards and essentially creates an extension moment in your lower back. And what happens with extension is that as your spine extends, the joints in your back close down. And not only do the joints close down, but the spaces that the nerves come from also close down as well. So if you are getting around in a position where your pelvis is anteriorly tilted, and it's no coincidence that the most common areas for stenosis in your lower back is right down the base of your spine, then you may be creating an unnecessary extension moment in your lower back, setting these tissues up to become dysfunctional over time. So one of the strategies that we can employ to improve how your stenotic symptoms feel is to try and reorientate your pelvis into a more neutral position, naturally taking some of the tension out of this area, increasing the space in the area, and hopefully relieving some of those symptoms. So with that in mind, it's important to understand whether you do have an anterior pelvic tilt going on or not. And a really simple way to test this out is if you stand up nice and tall with your feet straight and squeeze your glutes, tense your butt cheeks. See if it pulls your pelvis back into a more neutral position. And if it does, then we have some work to do to get you out of that naturally extended position through your lower back, which may ultimately be challenging those symptoms, if not creating them over time. And so the first step in trying to correct an anterior pelvic tilt is trying to free up a lot of the tissue at the front of your hip. One of the biggest missing components of an anterior pelvic tilt is that the tissues at the front of the pelvis become tight, most commonly from a lot of the sitting that we tend to do. And this naturally tends to pull the front of that pelvis forward, creating that anterior pelvic tilt and jamming up that tissue at the back. And there are obviously a number of different ways that you can stretch hip flexors or tightness at the front of your hips. A really simple one to do, especially if you find it hard getting down to the ground, is doing a seated hip flexor stretch. So being on the edge of the chair, being up nice and tall, have one of your butt cheeks off the chair. All we want you to do is just slide your knee behind you as far as you feel comfortable. We don't want you to lean forwards. We don't want you to arch backwards and create that extension in your back. We want to make sure that you maintain an up tall position. As we went through a second ago, if you squeeze your glutes, it'll put you in a good position. Then from that base, just slowly take your foot further and further away until you find some tightness at the front of your hip. Again, we don't want you to lose that good spinal position. We don't want you to dump forward into a pelvic tilt. Keep everything back. You will not go as far into hip extension in this position if you extended, dumped into a bad position and just worked around the issue. Pull yourself together, integrate yourself, squeeze your glutes up nice and tall, take that foot back as far as you feel comfortable until you find that tightness. Then what we want to do here is squeeze your glutes again, make sure they're still tensed, squeeze everything around your hip, tense up your thigh muscle, tense up your hips. Squeeze that for 5 to 10 seconds. As always, when you relax, those tissues, those tight tissues should give a little bit, which means that while while maintaining the same integrated position, you might be able to squeeze further back into the stretch than you could before. Then want to repeat that process. Squeeze everything up, hold that for 5 to 10 seconds. This creates that reflex in your brain that when you stop tensing, things give, you'll be able to go further again. Keep doing this on both sides, looking for where you can find those tight spots, free them up. Then what you should find is when you stand up again and you squeeze your glutes, you should feel like you're already in a better pelvic position than what you were before. And like anything, once we've started to mobilize some of those hidden restrictions, we now want to progress to something that incorporates strength. But as is the theme of this, we want strength from a good pelvic and lower back position. So when we turn our attention to strength exercises that help a stenosis, core strength or trunk strength is clearly important. We want your trunk to function optimally, and it's hard to have that if the muscles of your trunk aren't doing their job and maintaining a strong, neutral, well-integrated spine. And because we're looking at your stenosis potentially through the lens of an anterior pelvic tilt, we want to make sure that we get you out of that position to integrate back into a good shape, taking the tension off your back while we do a strength exercise. And a really simple strength exercise that I love for this is called a Pallof press. You can do it in standing. It just requires a TheraBand or some elastic band of some sort. We want you to be side onto the band. Pull your pelvis in a good position, maintain this shape. From here, drawing your belly in to help support that position. You want to grab the band, take a step out so you have as much tension on the band as you feel happy to bear, because the band is always going to be pulling you backwards. We don't want it to. So from here, if you can handle this position on its own, the further you straighten your arms out, the harder this exercise becomes and the more the band is trying to rotate you back the other way. But from a good position, we want to engage the musculature of your trunk and challenge them by adding an external resistance that's trying to break that position. Do a set of 10 on this side, then turn around, do a set of 10 on the other side. Do this 3 times at a resistance that you feel comfortably fatigues you without you losing that good spinal or pelvic position at any stage. We want to retrain your trunk and pelvic connection to be in a more integrated, more natural, more neutral position, and one that takes the tension off that part of your back. So we can try and get you out of that tilted position by freeing up the front of your hips and strengthen your trunk, retrain the muscles to hold you in this position so you're not walking around with your glutes tensed all the time. Then we are starting to make ground on some of the potential causes of that stenosis over time. And while it's obviously important to try and get to one of those root underlying causes of a lumbar stenosis, I still want you to have something that you can do if you are symptomatic and sore that may help those symptoms specifically. And while it's important to make sure that we're not doing too much extension or extension-based movements that ultimately close down the space, close down your joints, and may leave you a little bit more open to stenotic type symptoms, respectfully focusing on flexion-based movements naturally does the opposite. It opens up that foraminal space. It takes some of the pressure off some of those potentially sensitized structures in the area. So one of the exercises that I like to give to my patients is one where you are again conveniently sitting down. And depending on how sensitive the structures are in your back, what I would like you to do is having your hands on your thighs. I would just respectfully want you from your head, just gently start to flex your neck, flex your upper back, and then as you start to flex your lower back, start to slide your hands down towards the ground. If you're lucky enough, you may feel a sense of stretch or a sense of relief through your lower back. This is obviously what we want you to do. The wider apart you have your feet, the further down you may be able to go between your legs if you have that flexibility. But what I find is important about this exercise is we don't want you just to use your back muscles to straighten you back up again, because if they are a little bit sensitive, if your back is a little bit painful and irritated, that may be counterproductive. So once you've found your way down to the bottom of this position, what I would like you to do is, using your hands, reach up and put your hands on your knees. Use your hands to push yourself back up again. Lower yourself back down as far as you feel comfortable. Once you've found that natural end point, use your hands on your knees to push yourself back up to where you want to be. Do this 10, 15, 20 times. If you are symptomatic, ideally what you'll find is the more you do this, the less your symptoms will be there, the more relief you may start to find that you get. Now, obviously, this position is very similar to doing something on your back, pulling your knees up to your chest. If sitting is too uncomfortable for you, do this in a reverse position, lying down on your back. Pulling both your knees up, again, still gaps the lumbar spine. If this is a very simple starting point, please do that. You can hold this, you can let it come down. work your way through that, but ultimately we're wanting to try and find moments where you're actively opening up the base of your spine and then making sure that you're not using the tissue of that spine too heavily if you don't feel you can tolerate it to seek some of that symptomatic relief. Now, obviously we can do the same thing in standing if this feels comfortable and appropriate for you. It's essentially a glorified Jefferson curl where we want to start from your head, roll all the way down, segment by segment, as far as you feel comfortable. Now, obviously you may not be able to get as low as I can. I'm relatively comfortable in this position. We can get you to come all the way back up again, or you can just work within that end range, just flexing and extending that lower back, trying to ask that tissue to mobilize and free up. Now, obviously that standing position is a progressed, scalable position. As I mentioned, if your back is sensitive, you may need to get down to this position in sitting so you can use your hands to help you back up again. But doing assisted lumbar flexion in sitting is a very safe and effective way that I've found clinically to help with the symptoms of a stenosis. And if you are a member of the channel, in the extended cut of this video, we're now going to turn to an additional mobility exercise for your lower back. We're also going to talk about the important role of day-to-day posture and their influence on your stenosis symptoms. But with all that being said, it's really important to appreciate that your stenotic symptoms haven't come from nowhere. There always has to be a legitimate, albeit hidden, reason for why one specific part of your back has started to wear down a little bit, and structures are now starting to get irritated as a result. So while doing fancy exercises for your stenosis symptoms, getting you stronger and things like that as a whole is still really important, because you can do two things at once. We want to pair up those symptomatic exercises that I'm sure you've already been given or you've found through YouTube in some way, with a broader understanding of why you might need to be doing those things in the first place. So please let me know in the comments down below whether you feel you have that anterior pelvic tilt as well, and what impact freeing up your hip flexors and strengthening your trunk in a more neutral position may be having on your symptoms. If you found that this video was helpful, please let me know by leaving a like on the video and subscribe to the channel if you want more information like this from me. Obviously, please consider becoming a member if you want more extended versions of these videos. And if you would like specific help with your lower back pain, please consider booking in with me for an online consultation. But as always, once again, thank you for watching and I hope to see you next time. Bye.